Hi, my name is Dr. Joseph Cinderella. I'm a cardiologist here at TidalHealth in Salisbury, Maryland, and I'm going to talk about Heart Month a little bit today. I'm an interventional cardiologist. We have half a dozen of us here, and we do procedures both urgently and non-urgently to open up clogged arteries. We can take patients urgently to the cath lab and open up that clogged artery and really save lives. I think the earlier we get to the patients, the better. February's been Heart Month for almost 60 years, or over 60 years now. President Johnson established it in 1964 after he had suffered a heart attack himself. Risk factors are pretty much the same for men and women, and the traditional risk factors that we think of would be high blood pressure, high cholesterol, diabetes, smoking, and family history. You can't really do anything about your parents and grandparents, but you can certainly work on your cholesterol and other risk factors. The AHA, American Heart Association, recommends 30 minutes a day of moderate physical activity, brisk walk. You don't have to be on a bike or an exercise bike. You don't have to go to the gym, but at least walking around the neighborhood for half an hour a day is going to dramatically decrease your risk of cardiac events and just improve your outcomes altogether. The symptoms typically, most commonly, would be chest pain, pressure, tightness, typically mid, central, upper chest, left chest, jaw pain. Really anything from the ears to the belly button potentially could be heart. Women, historically, we've thought of them having a little different risk factors or different symptomatology as men, and women unfortunately seem to present a little later because they ignore their symptoms thinking it might not affect them. The first Friday in February, and that was established over 20 years ago as a special reminder for women to be cognizant and aware of heart disease in women. So women here in the hospital all wear red on that first Friday, which is February 6th, I think, this year. If you have worrisome symptoms, pain, pressure, tightness, don't ignore it. Probably EMS is the best way to go rather than just driving yourself in or have somebody drive you in. If you go to TidalHealth and just search under Garari Heart Institute or Heart and Vascular Institute, there's many links there that will help guide you through it.